Good morning, everybody. So my name is Gethin Nadin, and welcome to Maximising the Value of Your Wellbeing with Content. My name is Gethin Nadin, Chief Innovation Officer at Benefex, and today I'm joined by Kate Humphries, who's the Content Manager at Benefex, and Louise Nixon, Digital Wellbeing Manager at Benefex. Good morning, both. How are we doing?
Very well, thank you, Gethin. And yourself?
Not too bad, thank you. We were just talking about my cat is snoring behind me, so if you hear a slight grumble in the background, that's what that noise is. So to our audience, as always, we welcome any questions and comments you have for I or the rest of the panel today. So as we go, please put those in the chat or Q&A functionality on Zoom. But before we get to asking our panel some questions, I just wanted to set the scene as to why we're here and what we're talking about today. So back in February this year, as many of you may have seen, Benefex launched a new product called Home. Home is a new experience layer to all of the products and modules that you can get through Benefex. And a large part of how Home better supports employees and especially employee well-being is through content. In a well-being context, kind of Home brings together all these different elements of well-being. So that covers things like employee benefits, third-party tools, policies, and content. And it stops well-being from being spread across multiple systems and places. And it enables employees to find all of the ways that you support them more easily. And it kind of avoids that kind of confused and uncontrolled well-being and benefits messages that we've seen quite commonly in the past. And so content, we believe, will soon play a much bigger part in Benefex as we expand out all the ways that content will enrich the employee experience and the experience of every module that we offer. So whether that's better employee benefits content, so how do we get people to better understand the benefits that we put in front of them, to conceptualize and add a bit of context to some of those benefits, whether that is well-being, so how are we educating, and some of the stuff we'll talk about today is how do we improve things like health literacy to the content that we can provide to our employees, but even recognition as well. How can we explain to people why recognition is so important to them, their teams, and their organization through content? And all of that starts to enhance company culture in our view. And so we think when we get the right content in front of employees at the right time, that can really help them to understand work and make some better choices when it comes to things like well-being and benefit choices. But this content is also a response to a lot of things that you've been telling us as HR reward and benefits leads. So as well as content, you told us that you wanted more things in one place. You told us you didn't want benefits content in one system and well-being content in another. You didn't want all your well-being content on SharePoint and all your benefits and other well-being stuff in a different place. You didn't want well-being to cross over Yammer and Teams and intranet. You wanted one single home for well-being. But you also told us that you needed a better understanding of your people, especially when it came to their well-being. So you needed more ways for us to be able to tell you, what are people most interested in? What are they struggling with? What kind of additional support do they need in the organization? And you told us that you wanted to know more about what they were interested in and what you could be doing with that information and how that might change some of the support that you offer in the workplace. And so why do we think adding so much content to the Benefex experience is so important? I think largely what we're doing is we are responding to a change in how employees and consumers are actually finding and digesting content online. So as you probably all saw, and maybe did this yourselves, the pandemic forced many employees to take charge of their own well-being and to become more informed. During the COVID-19 pandemic, literally people's lives depended on learning more about the virus and becoming more informed on how best to avoid it. And I think as a result of the last few years, what we've seen is this shift in employees showing more agency and engagement with their well-being and actually wanting more information on how best to manage their health. And if we look at Deloitte's healthcare and consumer response to COVID-19 survey, we found that Brits and Americans are now far more likely to engage in health behavior change content and to take more ownership of their well-being. And in the last 3 months of 2021, 50% of EU citizens reported that they'd sought out health and well-being information themselves online. And so in addition to all that kind of data, we can also see that the use of things like TikTok and Instagram is changing and how employees and consumers want to access and digest content. So our shorter attention spans means we want to actually get content that's far more easily found and consumed. And so first of all, I'm going to come across to you, Kate. So can you talk us a little bit about what do we, how do we reach people where they are? How do we get them the content that they want to see based on all the work that you've been doing at Benefex?
Sure. So as you mentioned, Geffen, we are seeing patterns of content usage change quite a lot. In a corporate setting, this is largely because of younger generations coming into the workforce and as you mentioned, as a result of the pandemic as well. So for example, mobile video consumption has increased 70-fold since 2012, according to Cisco. And they predict that global internet traffic from video will make up 82% of all internet traffic by the end of this year.
Okay.
And whilst our consumption of video content has increased to around 84 minutes per day, the length of videos we watch continues to decrease, with the average being 1 minute or less, again, thanks to platforms like TikTok. In terms of what we should be creating, recent studies have found that digestible multimedia content, such as short form video, infographics, elements like that, sticks around in people's mind much more than just text alone. And they're also 66% more likely to be shared and have a proven 15% increase in information retention from that format of content. But despite what you do create, the most effective content, as you say, will always be personalized to your employees, their needs and their habits. Marketers have understood this long ago, and it's becoming more and more prevalent as HR teams use content to enrich the wellbeing experience.
It's quite interesting, isn't it? We've talked about this quite a few times over the last 2 years on these different wellbeing webinars about how HR and reward and benefit teams need to start to think more like marketeers, because we're trying to get people to buy products, to understand product and engage with it.
Absolutely.
And I think in big organizations where we have so many people with so many differing needs, the best way we solve that problem is to offer a lot of choice. And that's clearly very difficult to navigate for an individual. So how do we personalize that content? How can I just get the content that's most interesting to me at the right time in my life?
Yeah, so as I say, there's now this kind of growing expectation that the content we interact with in work is personalized in a way that mirrors what we see outside of work. So previously, content creators would focus on a single medium or a single audience, but now need to create content that is delivered to print, desktop, mobile apps, wearables, and more. Plus, take into account you've got multi-generational and diverse workforces. Whilst this doesn't mean that the written word is dead, it simply means that as employers, we need to be more aware of the way content is presented to employees and give them a choice in how they personalize that information. Modular content can really help with that. Modular content is basically content reuse. So when you modularize the information you're trying to communicate, you can start to map your content to different audiences, creating this more personalized experience. This is especially useful on a global scale where you need to communicate a unified message, but with potentially localized customization behind that. So the power of modular content is that it gives ultimate control to the creator to construct personalized content at scale across a range of channels, creating entire campaigns that can flow seamlessly between both print and multimedia formats. So with this approach, the possibilities for reuse are endless, but the source of truth remains the same, saving these content creators time and money in the long run.
And I think that's certainly been a challenge with the global customers that I work with, especially when we look at something like wellbeing, where you have perhaps an individual HR reward director who has a global remit and is trying to deliver a consistent message across the world, but actually within regions, that message might have to slightly change. So the bulk of a piece of content, for example, you wouldn't necessarily want to change that entire content, but you might have a region of the world where talking about mental health needs to be used in a slightly different way because of kind of cultural differences. And so I think, gone are the days, we hope, where we start to kind of produce content and have to just continually rewrite that for different audiences, different locations, which is quite interesting. So how do we kind of, as a user, how would we get people to preference the content that they see? And I guess also the second part of that question is, what do we expect now as kind of employees and employers as in that sense? Because obviously, if I can decide who I follow on TikTok, right? I can decide who I follow on Instagram. I can easily unfollow. I can follow hashtags on Twitter and LinkedIn. So I can find and follow specific information that I'm related to. I don't just see the same news feed as everybody else.
Exactly. Largely because of these social media platforms, we are now used to viewing content in a variety of formats via these finely tuned and personalized feeds that we control. Don't want to read something, remove it from your feed. Don't want to follow someone, remove them from your feed, just in a matter of clicks. So as a result, we've come to expect this level of preference curation in all points of life. And we get frustrated when that's not available as an option. So recent study by Adobe showed that over 42% of customers get frustrated when they're presented with content that isn't personalized. From an employee perspective, they expect to see content that supports them in almost every eventuality. So whether that's content that promotes wellbeing initiatives, benefits package, internal culture, the expectation is this can be accessed at the click of a button, digested quickly, but personalized to their own preferences. And from the perspective of an employer, you now have a highly diverse group of people that expect this personalized level of support throughout their time with you, which includes the content you provide to them.
And so how do we do that through tech? So in our world, in kind of benefits, wellbeing recognition, how can technology help people to preference what they see, what we put in front of them?
Yeah, so mirroring how we use social media, employees should have the opportunity to tailor the content that they see from their employer within reason, obviously, and how they engage with it. So working in a similar way to typical social media, platforms like Home puts each individual in control of their own benefits and wellbeing content, and means that they can then choose how, where, and when they receive it and interact with it. For employers, it means they can easily provide this truly personalized employee experience.
Excellent. Thank you very much. So just a reminder, if anyone has any questions about that, I appreciate this is kind of new stuff we're talking about Benefex. If you've attended any of our webinars before, you know, content in the context of well-being and benefits is very new. It's new to us as an organization as well, but it's something we've been kind of developing and researching for probably 4 to 5 years actually. But if you have any questions of kind of what we're talking about, and even if you know you're not a Benefex customer, you don't use products that we have like Home, if you have any questions about specifically how do you get content in front of your people where that kind of tech isn't available, then please do ask those questions. And so Louise, let's move on to you. You've been kind of working with lots of employers all around the world on wellbeing and wellbeing strategies. With all those ways that you've been consulting and wider Benefex employees have been consulting on wellbeing, we spoke regularly about the health belief model. And so in the context of content, how are we using content to kind of support employees to change behavior?
Yeah, so the health belief model is a great example of how content can be so powerful in driving healthy behavior change. So whether that's increasing physical activity, saving money, healthy eating, or practicing mindfulness, educational content can help to facilitate the transfer of knowledge from the expert or the healthcare professional to the consumer. So if we have a look at the model here, according to the model, health-related knowledge feeds into self-efficacy. And self-efficacy refers to the expectations of one's ability to perform the behavior. So if they feel that it's worthwhile for their health and that they're capable of executing it, they're more likely to perform the behavior. And over time, then this results in improved health outcomes that the individual learned about in the first place from the content. So for example, if the person is provided with content on the health benefits of engaging in 30 minutes of brisk walking, such that it will lower their stress levels, lower their blood pressure, and improve heart health, they now have the health-related content that they need. And they might consider this content and they might consider this knowledge and see whether it's feasible and decide whether they're capable of maybe walking 30 minutes to work every day instead of driving. And then they might make this a habit over time. And if they do make this a habit over time, it will lead to improved health outcomes.
And I guess a really good example of, for anyone who's attended some of the pandemic wellbeing webinars we did, we were joined by a couple of GPs a few times, and one of the things they were talking about, and they said, which is kind of mostly unknown by people, is the serotonin boost you get by going outside on a non-sunny day. It doesn't actually have to have much light in the sky for you to get that serotonin boost, but most people didn't understand that. So context can kind of remind people of that kind of fact, right? And that can encourage them to go out even when it's on a day like it is here where I am, where it's pretty overcast.
I know you both were mentioning how you like autumn, so definitely you guys should get out for walks.
Yeah.
But if we move on to the next slide, then we'll see that if we take a step back, one vital determinant for people to understand the content in the first place is health literacy. So what is health literacy then? When we take a look at the definition, health literacy, it entails people's knowledge, motivation, and competence to access, understand, appraise, and apply health information in order to make judgments and decisions in everyday life concerning healthcare. So health outcomes really do improve as health literacy advances, but it's not always easy. So there are constant challenges, whether that's limited technology and reading skills to misleading and biased information that exists online. But both the employer and the content providers play a crucial role in addressing these hurdles. And there's a growing body of research that indicates that limited health literacy can actually lead to adverse health outcomes. So on this slide here, then we can have a look at the research that has been conducted to date. Research has indicated that between 1/3 to 1/2 of all adults struggle with health literacy, and that 87% of people need help with health-related information. And the same goes for financial literacy. So a meta-analysis of 126 impact evaluation studies found that financial education significantly impacts financial behavior. And I know, Gethin, you've been doing a lot of research and work with financial literacy recently. Have you found that it's having the same impact with health literacy, and that maybe people need more financial literacy during this cost of living crisis?
Yeah, I think it is. I think if you look at data that's come out of the World Economic Forum, the London City Corporation, and many others, they're all talking about actually financial literacy plays a really important part in how people manage their money. And, you know, as you see on screen, 126 different studies finding that. There's probably more since that was pulled together. We only have to look back to the 2008 financial crisis. And if we look at research produced at the time by the Federal Reserve Bank in the US and the Brookings Institute and the White House, they all basically said that actually if the individual consumer had a better understanding of economics and financial products, the recession wouldn't have been as deep or lasted as long as it did in the US in 2008. And we've got similar stats that have been mirrored by the HMRC and the Treasury in this country as well, in the UK. So actually there's a pretty lot of evidence, and the World Economic Forum recently said that actually in times of economic strain, such as a recession, that financial literacy becomes more important. And especially so for those people that are less likely to have access to financial literacy through school or the workplace, because those are the people who are more likely to take on things like problem debt. And there is a direct correlation, the Bank of England tells us, between somebody's level of financial literacy and the expense of the debt that they take on. So basically, the lower your financial capability through literacy, the higher the likelihood you're going to take on more expensive the debt than you probably have to. So yeah, it's I think quite fascinating at the moment, and kind of as we go through the next couple of years, you know, getting people to make sure that the products they're buying, the things they're signing up for, you know, people are desperate at the moment. People are going to make some financial decisions that are not going to be great for them. People are going to lend money off people that they probably shouldn't be lending off, and organizations that might be charging them high APRs, etc. So I think making sure that people fully understand the impact of the decisions they're making is going to be really, really important. And sorry, I know we got off on a tangent, but I think one really good example we saw recently was a member of staff in the NHS in the UK decided to not just reduce her pension contributions, but stop her pension entirely and opted out of the pension scheme. I think about 6 days later, this member of staff died and lost her life insurance entitlement because she'd left the company pension scheme. And I wonder whether, you know, it's a terrible example, really sad story. That example, 2 young kids were left without any money to pay for funeral care, to pay for mortgage, rent. There's no money at all for these kids to be looked after their mother died. And, you know, I do think, you know, if somebody really understood the impact of withdrawing out of a pension, would that same decision have been made? I don't know. So, but I think there's some real life examples of that, having more information, having more access to content that's going to keep people better informed is leading people to have make some better life decisions, I think.
Yeah, it's really difficult times, and it's obvious that having access to the information is really important. And advances in technology mean that individuals have access to health-related information and content more than ever, wherever, whenever they want. So with modern health solutions and apps, employers can support their employees regardless of their geographic location. And this removes the physical barriers that traditionally impeded access to healthcare and financial support and resources, and allows for a more equal workforce that can support employees across the globe. So according to Sensor Tower Store Intelligence data, there were 290 million downloads of health and fitness apps in Europe in 2021. And in more recent research by Benefex, we assessed over 1,600 employees regarding their use of health and wellbeing apps. And while employees are using a variety of apps to support their health and wellbeing, the most commonly reported shortcoming of these apps was cost. And as you mentioned, Gethin, in today's economic crisis, spending £15 or euros a month on a wellbeing app is putting extra financial pressure on already stressed out individuals. So employers can support their employees with this financial burden by providing them with the health and wellness apps that they want to access, but might not necessarily be able to afford.
And compare some of those things, right? So how can content let you see the difference between if you might offer corporate discounts for Calm and Headspace, and so what are the difference between the two, and how can we educate you on, if you can afford to spend it, this is the best, but this is a really good second option, and give people that education? Because I guess part of this as well is nobody's got time to do the kind of research we would love them all to do, right? We've got we would love everyone to become an absolute expert in everything to do with their health, so they understood their risk of diabetes, they understood their risk of heart disease, all these different things, but people don't have the time. And as Kate covered, how do we use content to make decisions easier for people as well? It's not just about them being well informed, it's about making those easy decisions about it.
Yeah, and what's really important here is that they're able to understand the content that they have access to. So while the health related content is vital, it must be evidence-based, but it must also be in layman terms. So the content provider should deliver health related advice so that it's easy to digest and understand. And simple language really works best here.
Yeah.
So it must be culturally appropriate to the region that it's being delivered in, and it should be in language that the employees are fluent in the region that it's being delivered. So, for example, on the Power Wellbeing tool, we were asked by some of our clients to remove any food-related content in the regions that celebrate Ramadan. So we removed all of this content for the period of Ramadan and then reinstated it after, just to ensure that the content that they were reading was culturally appropriate to the regions that we're supporting. And in fact, the US Department of Health and Human Services recommends using a universal precautions approach. So what this means is to assume that all consumers are at risk of not understanding education and instruction. And this recommendation can really be applicable across a range of domains. So just as there's no point in an employee reading the benefits of engaging in high intensity interval training to lower systolic blood pressure if they have no idea what that means, it's also pointless for an employee to be told that they should be putting away 5% of their annual income into a pension if they don't know the long-term benefits of doing this.
Yeah.
So the consumer of the content must be able to comprehend the advice before they can, one, decide whether they agree with it and feel that they have the self-efficacy to follow it, and two, apply it to their everyday life.
And I think that the pensions one's quite interesting because I've been criticised for some of the comments I've made about pensions communications for a long time were issued by white men of a certain age, and they didn't really engage the younger, more diverse worker in many ways. But yeah, pensions are probably a really good example. You look at most people's engagement with pensions, lots of people are more enrolled in the UK pension than ever, but actually more people than ever are saying they don't understand it and they don't understand the choices they've got. And a couple of times even really high figures like the ex-governor of the Bank of England said he didn't understand his own pension. So it's kind of like, what does somebody working on a checkout have a chance if one of the leading economists in the country is not able to explain their own company pension scheme? And I think part of that is, do I trust the person that's putting the information in front of me? Because I think financial literacy is a really good example. Financial literacy, unfortunately, has been driven by a lot of financial services. Yet when you look at the data, they are not trusted, right? So it's not my words. There's plenty of data to say that people don't trust banks and building societies. People don't tend to trust social media companies. And a lot of the information we get comes through both of those sources. A lot of the data, the Deloitte report I quoted at the start, most people get their news through friends and family and through social media. Yet when you look at the Edelman Trust Barometer, financial services and social media are now the lowest trusted of all the major institutions around the world. People also don't trust the government. And so if all these people are not trusting these traditional institutions to give them that information, and they don't understand people like the state or the media, that employer becoming the source of truth becomes quite important, doesn't it?
Yeah, exactly. So the employer is becoming increasingly important in delivering this trustworthy information. So from the employer's perspective, it's vital that they ensure that they're using a wellbeing provider who only delivers evidence-based, regularly reviewed content in the fields of whether it's health or finance. And rather than opinion pieces, as you said, Gethin, that are provided by social media influencers or maybe celebrities, the employer should ensure that it's research-oriented and trustworthy content that they're delivering to their employees. And at Benefex, all of our content is contributed by experts. So on the Power Wellbeing tool, we have a wide variety of content curators who are experts in their fields, including physiotherapists, psychotherapists, nutritionists, financial wellbeing experts, and environmentalists, to name but a few. So in the words of Mark Twain, be careful about reading health books. You may die of misprint. So it's really important that the health-related content and financial-related content is provided by experts.
And it's Kate's role, for anyone listening, Kate's new role at Benefex is to design that content strategy and make sure that the people who are creating the content are the right people to be doing that, to make sure that content fits a kind of well-trodden path and gathers all the research to make sure that, you know, content's not overly long or unnecessarily wordy and is accessible in its very nature. So I don't know if you want to talk a bit about what the bits of research you've been doing, Kate, about kind of why we think the employer is one of the best people to do this, because I guess we saw during the pandemic, didn't we? You know, Boris Johnson would give a talk on a Sunday. HR teams had to kind of reword that into what are the new rules and then issue those to their people on a Monday. So it feels to me like over the last couple of years, people have leaned on their employer as a source of information more than perhaps they ever have before.
Yes, absolutely. But as well as that, there's also the other source of truth that people trust, which is their peers. So in a world where everyone can have their 3 minutes of fame with a TikTok video, it'd be wrong for us not to mention the power of kind of user-generated content in this context. So according to a study by the Consumer Technology Association, roughly 39% of the time we spend consuming all media is spent on user-generated content. And a recent State of UGC report found that 72% of people believe that content created by their peers is actually more credible than any brand talking about their own kind of products or services. And this is even true in the workplace, where 55% of employees turn to their peers to learn something new before going to any other source of information. And that's according to a study conducted by Decreed. So where our peers are one of the most trusted sources of content, how can you kind of incorporate interactive UGC, user-generated content, in a corporate setting and maintain control over the content that's created?
And that's like, YouTube's great for this, right? So if I'm going to buy a product, especially an expensive product, I will look at people's unboxing videos and reviews of that product on YouTube, and you get a unbiased, fully informed decision about, you know, how strong is that thing, you know, what's the packaging look like. And I think if you look at unboxing videos on YouTube, they must now account for a significant portion of the videos that exist on that site.
Yeah, exactly. In terms of from an employer perspective, so what can you do to kind of start incorporating this into the content that's created? So obviously making it easy. So at Benefex, we continue to see an increase in customers using kind of peer reviews, testimonials to showcase this real life application and impact that benefits can have. In the context of well-being content, it could be as simple as encouraging employees to share and feedback on the product services that have worked for them, and starting to build more of this kind of community approach to well-being initiatives. Obviously, if what you also have to do as part of that is give employees the right tools and the support to do that. So if you're just starting out with content, this could be as simple as identifying key people across the business who can support you, ensuring they have the access and the permissions to the technology they need to share their thoughts and opinions. And obviously the flip side of that is obviously having a robust approval process. So this could come in the form of permission settings and admin rights to approve content before it's published if you're using a platform like Home, or it could be as simple as a submission email address if you're managing it manually. The benefit of introducing user-generated content in this way is that it means content creation is no longer just HR alone's responsibility. It becomes business-wide initiative and something that supports the growth of your internal culture as well.
And we mentioned at the start about, you know, our own research saying that the vast majority of customers we work with said they needed to get a better understanding of their people and what they wanted, especially when it came to their well-being. So how can, what part does social orientated content play in that? How does that help us to build a better understanding of what our people want?
Yeah, that's a good question. So content created and posted in this kind of social context, like on home, it leaves a trail of engagement that will help employers understand what employees are interested in, what they can help them with, and the tangible evidence of what your employees think as well. So where surveys, for example, take a snapshot in time, social engagement monitoring provides a constant stream of data. So through an employee experience platform like Home, not only can you see stats on how many people are viewing, reading, interacting with content, you can see the social engagement element as well, which gives you a far better understanding of what your employees actually want. In its most basic form, an employee commenting on, liking, and then sharing some wellbeing content with their peers is a far more valuable indicator of content performance than just views alone. And when you bring well-defined kind of topic categorization into the fold, you can start to build a really clear idea of what your employees want and then feed that back into your wider wellbeing strategy.
Really, really interesting. I think it's yeah, that kind of trail of engagement that you said, I think that's a really good phrase, because historically we're looking at engagement data in a very kind of structured black and white way, aren't we? It's kind of, you know, you're looking at, did somebody read something and how long did they spend reading that article, which will tell you something, useful. But yeah, I think I would agree. If you've got a piece of content that's prompting debate, that's getting lots of likes, that's getting people sharing it with each other, that arguably tells you a little bit more about an issue that might be going on in your organization. If I've read something and I want to send it to somebody else to read, that's more powerful indicator of the value of that content, I think, than me just wanting to read it alone. Right?
Yeah, absolutely. Absolutely.
And I think we've kind of covered it a little bit, but I think it's, you know, in this era of kind of clickbait content and fake news, I think finding the real or best content from a trusted source has clearly become very difficult. And I think for those who seek out health and well-being information online, the kind of credibility and trustworthiness of the information is their primary concern. And that's what the Deloitte Consumer Research found as well, is actually, who do I trust to give me that information, is a very small pool of people. We saw that global content consumption doubled in 2020, and the data shows us there's no sign of that slowing down. And so finding the best content from the best sources is inevitably a big, big challenge. And I think that provides a really big opportunity for employers to improve things like financial and health literacy for their people. But also, I think whilst providing that information, that's going to be critical to each of them in improving their own lives and well-being at work. Especially as we've talked about, the employees have this direct route to the most trusted source in their lives. For 72% of people globally around the world, the employer is the most trusted institution. So, you know, getting that information from the workplace now starts to be the most obvious. Any questions anyone's got in the last few minutes? But I'll come to you for the for final words, Louise.
Yeah, thanks, Gethin. So as well, I think we mentioned how important it is for the content to be trustworthy and provided by experts, and for the employees to understand the content, but they also must be able to apply the content. So educational content is vital, but you need to pair this content with a diverse range of digital interventions. And that's really key in creating long-term behavior change and healthy habits. So on Power, the digital wellbeing tool that we provide, we found that a combination of educational content and digital interventions has led to improved wellbeing over time. And our most popular content items in the past 6 months have ranged from articles, soundscapes, webinars, podcasts, and healthy recipes. So it really is that, like, diverse content can help to solve diverse problems. And as much as populations are diverse, people are also diverse. So they need appropriate, trustworthy content that they can apply to their everyday lives in order to improve, whether it's health or financial well-being. They need it to be trustworthy.
Excellent, thank you. And Kate, you're leading content at Benefex now. This is a kind of exciting. I kind of wish I was doing your job. I think it's an exciting place to be. Kind of what are you most excited about when we look at taking content en masse to our customers? What difference do you think it's going to make to our customers and their people?
Oh, a huge amount of difference in supporting employers in just providing that the right content to people at the right time. I'm really excited about all of the different opportunities and topics we're going to cover, and the opportunity to really bring and really make a difference to people's lives, just with the opportunity to give them a little bit of extra help
Excellent. Well, really appreciate you all joining us today. Thank you very much. If there are any questions following this, please contact us. You can just contact anyone at Benefex directly. We'll endeavour to answer those. But really appreciate you joining us. And thank you so much to Louise and Kate for sharing their experience and expertise. Thank you. We'll see you next time.
Thanks, everyone.
Thanks very much. Thank you.